Hi, this is Dr. Scott Hoare from Alcoa Chiropractic Center. This is Dr. Ben Rasnick, and today we're going to tell you a little bit about spinal decompression and how we use it with our patients that are having either neck or low back pain, and even a couple other things as well. So, Dr. Rasnick, tell us a little bit about decompression therapy and how it's used here in the clinic.
Decompression therapy started initially for bulging herniated disc. The therapy directed specifically at that. When we look at what that's trying to actually accomplish, the disc itself being the cushion that's between multiple vertebrae, we think a lot about that as like a water balloon, where if we continuously throughout our day and throughout life are applying compressive forces to it, the material inside that disc starts to make its way to the outside of the disc. And if there is repetitive traumas, micro traumas, if there's a significant trauma like a car accident or a heavy lifting injury, there are cracks or fissures that develop inside the disc. And the material inside that disc starts to make its way to the edge and can balloon outward. And that ballooning, that bulging of the disc material, oftentimes happens in an area of the disc where the nerve root exits out the spine and compresses against that nerve root and cause a lot of pain. So the decompression therapy is a therapy that comes in and does axial distraction of the spine, actually stretching the spine in a lengthened position. And if we think about compressive forces on a water balloon, when we compress a water balloon top to bottom, it's going to squeeze everything to the outsides. But if we pinch that water balloon top to bottom and separate that, pull apart, it creates an internal vacuum on the disc, sucking that material or drawing that material back to the center of the disc, therefore pulling the pressure off the nerve root and allowing for there to be relief from pain. If you can do that long enough, frequently enough, and keep the swelling down, you start to get a little bit more of a scarring type approach to the outside of that disc where it was damaged, and it creates a barrier there that helps keep that from being a problem in the future.
Is there any pain or discomfort during the treatment?
There can be. A lot of times when we're using this therapy due to the disc issue itself, people are in a lot of pain with that or can be in a lot of pain. When we start to traction them out, we pay attention to what their level of pain is, the potential of spasm that's taking place in the spinal musculature. So we start out in a specific manner in the protocol where we ease the patient into it and make sure that they can handle these approaches before we get to the heavier pulls with that. But there can be some soreness with it, but most of the time patients do really well.
What about those that say that they've tried like an inversion table or that sort of thing, and they really question whether this is an effective treatment?
That's a good question. We get asked a lot about inversion tables or teeter-totters, the different brands that are out there. The inversion tables use your body weight as a mechanism of being able to pull or axial distract the spine, and it's a good at-home use. Does it work as well as the clinical versions? And it does not. It's a good adjunct therapy for it, but it doesn't take place of it.
Is this therapy mainly for low back pain, or does it treat other conditions?
No, it does a great job across the spine. The main things that we use it for here in the clinic is for lower back and neck pain. So we're looking at the two main areas where disc bulges can take place, which is the lower cervical spine and the lumbar spine. And so both of those are the most frequent that we use, but you can also do things such as distraction for the wrist, which is good for carpal tunnel. When we talk about the decompression aspect of it and how it's affecting the disc, there's kind of an off-label usage on the decompression as well as the facet joints and the jamming that takes place and the compression that takes place on the facet joints themselves of the spine. The opening up and giving space between those facet joints is also a benefit. So the patient may not have a disc bulge going on, but they've got compressive forces on top of these facet joints, and going in and stretching that out and opening up the space there is also good. So facet syndrome, it's a very good option for it.
How long does the treatment last, and how many sessions do you typically see?
For most patients, the protocol that we use has the patients somewhere starting at a minimum of 20 minutes and can go up to 30 minutes. It depends on what the approach is and how strong we want to go, the weight versus time. We've settled into closer a 20-minute type of therapy and see that we get the best results with that.
What about frequency of care?
It's a repetitive therapy. So this is a therapy that it is not a therapy that one time you notice a significant amount of relief. Some people may. Some people, if they've got compressive forces on a nerve root and we go in and do that first traction session, they may have significant relief after that first one. It's a repetitive thing that builds upon itself. So each time we do it, we get more and more accomplished with that because we're slowly trying to make a correction to something that has made its way in the wrong direction. When it comes to like a bad disc bulge that we're treating, it can be as many as 20 to 25 visits on that if we're looking to truly correct a disc issue. When it comes to facet inflammation, it doesn't require nearly as many, but it can take some time. And if it's a significant disc issue, it can take 20 plus visits to truly get correction there.
Well, and then the big question, does my insurance cover it?
Unfortunately, insurance does not. Even though decompression therapy has been around for decades, the insurance companies still look at this as experimental type therapy. There's a significant amount of research out there that proves what this therapy is and what it does and how beneficial it is. Insurance companies have not come around to that yet. So not many insurance policies cover that. So typically it's a cash service.
So how can potential patients get in contact with us to schedule decompression if they think that's appropriate for them?
So that's pretty simple. If it's a new patient, reaching out to the front office, talking to them, letting them know what their conditions is, what their questions and concerns are. We'll get scheduled with a new patient appointment where we can sit down and talk with one of the doctors or the nurse practitioner and determine, making sure that that is the appropriate therapy that they need. If it's a current patient that's already in our systems, it's simply having a conversation with the doctor and asking about this therapy, talking about what that condition is that they're dealing with, and if the doctor truly feels like that's a good fit for them.
I'm Dr. Scott Hoare. This is Dr. Ben Rasnick. We're at Alcoa Chiropractic Center. And don't forget to hit the like button, leave a comment below, and give us a call to schedule your decompression consultation today.